So someone asked us, for those who've had a spinal nerve implant for pain, is it good? Would you have it again? Now, I obviously haven't had one of those, but we've treated patients here and seen them who have had them. And although it's not our field of expertise, we see the consequences of having them. And the one thing or one bit of advice I would give you if you are thinking of having it, or if this is an option for you, has been discussed, is make sure you really understand where the pain is coming from and how your spine is actually positioned, because this really I think will impact the outcome and what happens after you've had it done, because you're very limited. Once it's in, it's really kind of in more or less permanently. Now, if for example the spinal implant's in here and it's for an injury, say a fracture or something like that, that just hasn't resolved and it's the last choice, fine. But we've had some patients come in where they're off to the side like this and nothing's been done to accommodate that issue. So they have the nerve implant, but they're still in an awful position in their spine structurally, and some of that can actually be changed. You can actually make an improvement there, or at least give the person physiotherapy or some sort of exercises to help provide them with greater stability and support for the core. The biggest mistake that I'd seen in the patients that I've seen have it is there's been no advice after having the implant. It's just like, oh, your pain's going to go away, or it'll do what it does, and then you're left with whatever's left. There's been not sufficient advice on stabilizing and supporting this area of the spine that the pain is coming from. So they're left with instabilities and not really that much guidance. So in short, if you are thinking or have been advised to have or consider a spinal implant, make sure after it's done you get the appropriate advice with regards to looking after your back to make sure you absolutely minimize the risk of having any negative outcome afterwards.